Those are huge problems. What was the second question you had?
Is there any aspects
of the healthcare
plan?
The worst, yeah, absolutely. I mean, when you pass a bill with 2,500 pages, chances are you're going to get a couple things right in the bill. And I think they did. They got healthcare portability, by the way. I don't think that was in the bill, and it should have been.
Yeah, well,
it should have been in the bill. Covering pre-existing conditions, absolutely should be. It should be covered in any health plan. But if you had portability, if I had a health plan that I could carry from my private employer to private employer to private employer, pre-existing conditions would be much less of a problem, right? Because I would be changing health benefit coverage. Because, if you had it. Now, it seems to me that things have gotten a lot more complicated with these health plans. I've got a health plan right now, a health savings account, which is pretty darn complicated. It's got a huge, it's a $6,000 deductible. But, by the time you peel away all the layers, it works for Kathy and I. That's the plan that works. And the problem is, back when I was growing up, my father was writing checks as each of my brothers and sisters were being born under major medical. You basically paid your doctor bill. You had coverage for catastrophic illness. And today we're in a society, it's not just the idea that everything gets paid for, everybody wants to benefit. On the healthcare side, we sort of expect to be able to go to our doctor and have it all paid for, and nothing comes out of your pocket. It's a problem, because then nobody knows what the true cost of the medical visit was. And doctors, it's not just the consumer loses sight, the patient, the doctor loses sight. And they've got 5 people in the back office arguing with some bureaucrat in Washington or some bureaucrat inside a health insurance system about whether or not an MRI is covered under the plan or not. And so it's more and more on bureaucracy and more on administration and less for the doctor and the patient. So there are a couple of things. Pre-existing conditions I absolutely would keep. Most of it, including the government mandate, I would eliminate.
How about competition in the state?
Absolutely. That was not part of the plan. I'm for tort reform and for purchasing insurance across state lines. So that, and it's not like, I think those of us who live in Pennsylvania, it's not as if we're going to be able to, you could theoretically find a plan in California on the internet that might cover you. The truth is, what you're really going to, I think the benefit is going to be, we'll see better plans perhaps in the state of Delaware, the state of New Jersey that are closer to our medical system, Capital Health System, St. Mary Medical System, and that's where the real benefit is going to come, through these regional competitions. But right now, under federal law, we live in Pennsylvania, we technically can't buy our health insurance across state lines, and that's got to end.
Thank you. Next one, this is appropriate. When you go to repeal the health care I think I read November 12th ago you said, you'd also be repealing the provision that would allow people like me when I graduate college to stay on my parents' health care plan. You said that you supported that position, but when you go to repeal it, would there be any amendment to retain that 26 health care provision that would allow me and my sisters to stay on my mom's plan when we don't have any benefits or defects there?
I would support that proposal. Okay, I'm not going to tell you as I stand here. First of all, I'm not sure there's a date. You said there's a date set for.
I just read it. They're scheduled to vote next week or a couple following weeks.
Yeah, I mean, I think it's coming up in the first quarter, and it needs to.
That started in January 1.
That, yeah. I believe that the fact is your coverage on your parents' plan, your coverage, because you're a young guy and most demographically, most young people are fairly healthy. The cost is not all that great. I think what you're interested in is you're interested in getting coverage. But the federal government, pardon me?
26 years old, absolutely.
Right. What the federal government is interested in is getting you on the insurance system, because they don't want a bunch of uninsured young people who are uninsured by choice, because they need somebody to subsidize the rest of the population that's in health care. And that's the slippery slope I think we end up on, where you've got the federal government now mandating a private insurance product. But the idea of making it easier, for uninsured students or recent graduates to have coverage, I'm for that.
So would you vote to repeal the health care bill? Because that provision would be repealed as well.
Yeah, I've said I will vote to repeal the 2,500-page bill, and there are certain provisions that in a replacement bill need to be solved.
Where is it? Where's the bill? Where can I see a copy of it?
What I'm concerned is when you vote to repeal it, there's no strings attached to say that you're going to retain
You have no health care plan.
Let me just, Mr. White, please. No bills have been introduced because they can't until
You
January.
would think you would have a plan since you've had all this time. The Republicans complained about this since it was passed. The Republicans have no plan. You had 6 years to pass a health care plan and you didn't do it. And now you all hate the one that's passed. How will you do your mandate if you have no mandate? How will you make your plan work?
Any other questions?
Is